Good morning, everyone. My name is Millicent Gorham. I am the CEO of the Alliance for Women's Health and Prevention. For those of you who may not know or may not be familiar with AWHP, we work to advance policies to ensure equitable access to high quality, affordable preventive care for all women and girls. January is Cervical Cancer Awareness Month. Despite being a nearly preventable form of cancer, cervical cancer still kills thousands of women every year in the United States. AWHP is committed to raising awareness about cervical cancer screening and prevention and advancing policies that promote cervical health. Today, we will be discussing the importance of cervical cancer screening and helping women navigate their screening and prevention options. For our discussion today, I'm thrilled to be joined by Dr. Verda Hicks. Dr. Hicks is the president of the American College of Obstetricians and Gynecologists, better known as ACOG, the Professional Association of Physicians specializing in obstetrics and gynecology in the United States, representing more than 60,000 physicians. Dr. Hicks is a gynecologic oncologist and recently served as the chief of gynecologic oncology at Jersey Shore University Medical Center and medical director for gynecologic oncology for Hackensack Meridian Health Center, both in New Jersey. Before that, she held faculty positions at the University of Kansas and University of Missouri, Kansas City. Let's get started with our first question. Dr. Hicks, as a gynecologic oncologist, what do you see as the current state of cervical cancer prevention here in the U.S., and what successes or barriers are top of mind, and how can we do better?
The current state of cervical cancer prevention in the United States is improving, but it is still a work in progress. There are two major pathways that must work together to eliminate cervical cancer. The first is vaccination, and the second is screening. Vaccine acceptance of boys and girls aged 13 to 15 is improving in our country. It has increased from 40% to 60% during the years of 2016 to 2021. This is success, but we still have 40% of that future population of our country that is not protected against HPV diseases and cancers, such as cervical cancer. The second pathway that must work along with vaccination is screening. This includes both access to healthcare providers to do the screening and patient financial resources to enter screening, as well as acceptance of the patients themselves to be screened. If we can solve the vaccination and screening issues, we can then see a future for our country where cervical cancer becomes a rare cancer or eliminated.
Thank you so much for that. So why do you think that cervical cancer deaths persist in the U.S. despite the tools we have at our disposal to prevent them? And how do we get more families to take up preventive measures like the HPV vaccine and cervical cancer screening at an early age?
Cervical cancer deaths persist because, again, lack of vaccination and lack of screening. All who remain unvaccinated are at risk for HPV infection and related diseases and cancers. So if we are unvaccinated, we're at risk for cervical cancer. If we are unvaccinated and we do not have regular screening for HPV-related diseases, we are at risk of cervical cancer and thus from death from cervical cancer. It is important to note here that vaccination prevents the majority of cervical cancers, but not all. The vaccine works against 9 types of human papillomaviruses. 7 of those are the most common that cause cervical cancer. 2 cause genital warts. And so even patients who are vaccinated, they may still have that small risk of having an HPV that is not protected by the vaccine. So they still need regular screening for cervical cancer.
Can you tell us a little bit more about some of the most common misconceptions surrounding cervical cancer screening and prevention that you see and hear?
Common misconception that I see is really the understanding of the relationship of human papillomavirus as a causative agent for precancer and cancer changes and other infections such as genital warts. And also the understanding that HPV can cause other cancers besides cervical cancers. It is involved in 90% of anal cancers. Oral and throat cancers, 70% of oral and throat cancers are caused by human papillomavirus. And even men can get penile cancers, skin cancers, related to human papillomavirus. So the understanding of what HPV is and does is probably the first misconception. Second is understanding how successful the HPV vaccine is. I think, the vaccine hesitancy, people wonder, well, is it really a benefit? Is it really going to help me? And, what we are learning in the population that has been vaccinated is that the pre-cancer and cancers and other HPV-related cancers and infections, they have dropped dramatically. And so it is a highly successful vaccine in preventing cancers. Another common misconception is that this is a problem for older women, and that is a tragedy because we certainly see women in their 20s and 30s who have, cervical cancer and advanced cervical cancer, and to have all these preventative tools available and to see that still happening today is heart-wrenching, heartbreaking. So again, thank you for this opportunity to share with you my thoughts and dedication to elimination of cervical cancer.
Thank you again so much, Dr. Hicks, for joining me for the AWHP's latest Fireside Chat with women leaders in medicine. I really appreciate you sharing your time and your many insights with me. Thanks to everyone who tuned in, and we encourage you to all learn more about AWHP at womenshealthandprevention.org. Again, thank you so much for joining us.